During this video will be presented the project of one of the groups from the Project of Productive Systems 1, discipline of the first semester of 2017, having as basis for presentation this poster elaborated by students. The project proposal was based on observations of several problems in the preoperative stage of the University Hospital of Brasília, HUB. From this came the idea of a project looking for solutions to the identified problems. These solutions should be mainly focused on the cost reduction of time, money, or human resources. Therefore, the scope of this project is the proposal of improvements in order to reduce costs of the preoperative of the hospital, HUB. Regarding the methodology applied in the execution of the project, the group looked for information in literature as articles, websites, and books that somehow could add to the elaboration of this project. Furthermore, there had been a closer contact between the members of the group and the customer, so that meetings were held in order that the project proposal was understood by the members, and that they accomplished what had been demanded and fulfilled what has been requested by the customer. The client satisfaction was one of the goals that guides the methodology and execution of the project. The HUB hospital is a health unit linked to the University of Brasília. It is a federal public institution which performs free medical care by the system SUS. The literal translation would be Health Unique System. The project goal is to identify problems in the preoperative stage and propose improvement suggestions in order to optimize this surgical stage. Initially, will be assigned the problems. The first problem identified was the lack of well-defined criteria to the prioritization of the surgical queue. That means that the position of the patient on the surgical queue is not defined out of a transparent methodology. Basically, the specialty clinic selects the patient which will have the surgery. However, it can't be known if the queue is being properly respected. Even if it is respected, it also can't be known if the queue is set from an impartial system which regards clinical aspects. Another problem is that each clinical specialty has its own methodology to organize the surgical queue. There are many methods of setting the queue up. This shows that the hospital has no well-defined parameters about how to position the patients, and this can cause a bad formulation of queue which does not prioritize the people that actually need. From the first problem arises the second one, the need of judicialize the public health service, which means that it is required a transparent system with well-defined criteria to elaborate the surgical queue. From these two problems came the third one, the doctors having too much power of decision to define the parameter and the methodology to elaborate the surgical queue. In other words, it is a problem that the doctors are the ones choosing how to position the patients on the queue because the methodology applied is not clear nor transparent. Therefore, the main key of this adversity is within the fact that this power should be transferred from the doctors to the institution. That is, the methodology to position the patients on the surgical queue should be elaborated by the hospital and the doctors should apply it on all the patients. Evidently, the parameters should be adapted to each medical specialty, but the methodology should be the same for all of them. Another problem that has been observed in the hospital is a recurrent complaint to the Brazilian public hospitals, the delay on a queue. This problem can worsen the health condition of the patients and invalidate the exams already done. Once that the delay can expire the date of efficiency of the medical exams. Besides that, it causes social insatisfaction since the public service isn't properly serving the community. Regarding issues related to the administration of the preoperative stage, it was observed a serious problem related to the hospital's database. A lot of the information is outdated. It prevents the hospital of having correct data about the patient, which can hinder the sequence of the surgical process. The last problem identified is a result from the previous ones, the impossibility of getting in touch with the selected patient to the surgery because of the outdated database. Since the information is not correct, many times it can't be informed to the patient that he was indicated to have the surgery because the people responsible for the contact can't get in touch with the patient. The employees look for information by other databases, as for example the SUS database, but often without satisfactory result. In extreme cases, the patient loses the benefit of the surgery and comes back to the queue. These were the problems reported to the group members, and from these complaints, the students looked for improvement proposals to each of the problems. Next will be presented each of the suggestions made by the group. The first proposal considered by the group was the elaboration of a single system of prioritization of the queue common to all specialties. Thereby, the hospital would have a transparent methodology about how is made the allocation of patients on the queue. Besides decreasing the bureaucracy of each specialty having to make a queue and give the selected patient's name to the surgery, this strategy of having a single system would bring more confidence in the hospital by the patients and society itself. The second solution is profoundly related with the first one. Establish real criteria to the prioritization of the queue. To elaborate a system of prioritization of the queue, it will be necessary that this system follow the prioritization criteria, such as impartiality, equity, waiting time, and health condition of the patient. Therefore, what is suggested is that these parameters are well defined and followed on the moment of positioning a patient on the queue. The third solution is a result of the other two ones. Decrease the doctor's power of decision and make it the institution's decision. From the moment when it is created a methodology based in well-defined criteria to prioritize the queue, the specialty clinics no longer define the methodology they would use to position the patients on the queue. Since this methodology would be made by the institution, that is, the hospital itself, there would be a fair and more confident way of positioning the patients on the queue. The following proposal is related to a greater transparency of the hospital, the disclosure of the surgical queue on the University Hospital of Brasília's website. The group suggested that the hospital disclose the surgical queue on the HUV's website so the patients can keep up with the queue with greater comfort. This strategy would also aid the hospital because the patient himself could get in touch with the institution and find out about the date that will be performed the surgery and prepare himself to the procedure. That would avoid the patients to miss the surgery because of lack of knowledge that they were selected for it. Another suggestion by the group to improve the performance of the preoperative stage is the regular return of patients to the hospital. This would bring many benefits. The first one is that the doctor could observe the patient's health condition and, if necessary, change the patient's position on the queue. Another positive aspect is that the patient could keep up with his status in the queue and know his position. Besides that, this measure could avoid the patients to miss the medical exams for being outdated, since the medical monitoring could also be used to realize new exams when necessary. The group suggests the creation of a platform on the hospital's website where the patient could access his data online. If that platform was applied, would be avoided the problem of the employees not being able to contact the patient because of the outdated data. We could still suggest that the patient call the hospital a month before the surgery. For that to happen, the doctor should inform, at the day of the medical appointment, which would be the most likely date for the surgery. A month before that date, the patient should call the hospital to check if the queue is proceeding as expected and confirm his personal information on the database. This would avoid that the patient miss the surgery. The last suggestion from the group is that the hospital should have access to the database of the program, Bolsa Família. This social program demands that the database are up to date so the person can receive the benefit. Therefore, if the hospital has access to this database, would avoid the problem of not being able to contact the selected patient for the surgery. In this way, the project accomplished its goals of proposing improvements to the preoperative stage of the HUB hospital. It can be noticed that all the identified problems were contemplated with an improvement suggestion, analyzing sustainable aspects and its environmental, social, and economic dimensions. We expect that this project can be useful in any way to the hospital and the society.